The incision phase in hair transplantation involves creating tiny recipient sites where the extracted grafts will be implanted. This step determines the direction, angle, and density of the transplanted hair, directly affecting the final result.
This is Dr. Erdoğan. I'm in the incision phase of Alan. We extracted the grafts, we see the graft quality, the size of the grafts, also the length and width of the grafts to choose the right blade.
How is it done? Hairline and recipient area planning. The doctor designs the hairline and recipient area based on natural growth patterns and aesthetic goals.
So I'm now creating the recipient site for 4,500 grafts.
Using specialized tools, incisions are made with sapphire or steel blades in FUE.
In the incisions, we are using some tools to do the penetration through the skin, like 4 millimeter, 5 millimeter length, and some width, like 1 millimeter, to create the holes in the recipient area. So after that, we will implant those grafts inside those holes that we created. But the important things when we are doing the restoration is the tool we are using first. Secondly, it's the direction of the hairs, because they need to be in the natural direction of the hairs. If the patient has already some hairs in the scalp, in the frontal part, we can just mimic the same thing with that. We have the same direction. So it means that that will be naturally growing. But if there is nothing, no hair, at that time we determine the directions, usually from left to central or right to central. So more centralized incisions are much better according to the naturalness. Also, another factor is the angle of the incisions that we are doing. Yes, this blade has some angle, like 60 or 45. We have different angles, but also when we are doing the incision, for the frontal part, for example, we want to stay in 10 to 20 degree of angle, so the hairs will not be go in upward direction. That looks more natural, and that is more according to the natural hairs condition. When we are just doing in the mid scalp or the crown, it is raises up to 45, 50 or 60 angle even in the directions.
Creating natural angles. Each incision is carefully made at the right angle and depth to ensure natural hair growth. Ensuring proper spacing and density, incisions are strategically placed to achieve a balanced, natural-looking density without compromising scalp health.
So once I complete this part, we will be implanting. So it takes usually 1.5 hours or 2 hours up to the number of grafts, but the implantation takes 2 hours too. Patients are usually comfortable in this part because they are lying on their backs, and we are able to talk with the patients. It's not confusing for us because someone is counting the numbers that we are doing, but we have a good talk about the patient's case or the other things. So the comfort is much better for the patients actually. We created a plan in the morning with Alan according to our hairline and hairline style. So we created a frontal part, which is 55 centimeters square. According to the graft quality, I'm usually using 45 to 55 follicular units per centimeter square. If it's very thin, we increase the density, but if the thickness of the grafts are more, it may be even 45 sometimes. 50 is the ideal one, but for Alan, I'm doing 55 follicular units per centimeter square, which will be ended up with this area, the frontal area, the semicircular area, up to 2,500, because he has already hairs here and we want to protect them. When we see a thin hair, we always use our blade to just do the incision, the penetration between those hairs. So we have two thin and one thick, which gives the cumulative thickness to especially for that area.
Why is incision important? The incision phase is key to a natural, long-lasting, and aesthetically pleasing hair transplant result. When performed by skilled specialists, it ensures optimal hair growth and seamless integration with existing hair.
After I complete this part, probably in the middle part, especially in the central part, we need more density because it looks more empty and low density appearance. The sides are good. That's a positive thing with most of the patients if they have such a receding part, because when the both side, in the mid scalp or in the crown, is lost many hairs, at that time the area is becoming more and larger. That means the patient needs more grafting. But if it's a small area in the lateral parts, then we can achieve the thickness and the density with even low numbers.